My name is Lilian Carrasco. I'm originally born in the Dominican Republic. This is my son, Eric, my father, Robert, and we lived in the Bronx. Currently, I am on Medicaid.
I like going to my doctor. I feel safe. He takes care of me. But when he sends me to a specialist, it's a long wait. My mom has to pay a taxi for me to get over there, or I take the bus.
Also, another issue, my primary care physician doesn't get the results as it should. Sometimes I have to go to my primary care physicians. They have to call the specialist office because they have not received the results.
腰痛肉痛，我自己唐人街，紐約唐人街。呢個係我嘅孫女，呢個唔識得英語嘅嘛，我需要醫生識得講中文嘅，咁喺我附近治。
She obviously has a lot of disability and moving around, and it's really difficult for her to go out of the house to just make a trip to the doctors.
My name is Lucille. This is my daughter, Alicia, and this is my sister, Jackie, and we live in Harlem.
Healthcare is very important to me and my family.
In this community, we have a lot of people on Medicaid, Medicare.
One of the missing links in our community, as far as doctors are concerned, is preventative care.
Unfortunately, I had to take my father to the emergency room a couple of weeks ago, and we was there from 9:30 in the morning, and I didn't get home till midnight.
Hello, Ms. Corbin. How are you today? Good, good. Advocate Community Provider is the next wave of healthcare.
What makes ACP unique, different from other networks, is that we are a group of physicians, led by physicians, and we are dedicated to serve our community.
As we know, New York City is a melting pot of different ethnicity. So in this model, we can integrate with different ethnicity of provider to contribute our effort to meet the specific needs of our own community.
Cuando yo busco un doctor, prefiero buscarlo que hable español.
Having a doctor in the community who knows my background, our culture, is extremely important to me. It's easier to talk to him.
As part of a network with ACP, we're hoping we can expand access to care. As a solo physician, you can't do everything by yourself. With network of physician, we're hoping you can have people within the network who can, expand hours, who can also deliver specialty care sometimes under the same roof. We can bring specialists into the practice rather than having to send the patient all over the place. It's easier to coordinate care as a network.
So patient go to see the specialist, we can access the record. And in the past, without this type of network, the record will be lost.
Now we're going to have the opportunity to share the information. Developing the protocol is going to allow us to have a better follow-up of the patients. We're going to have guidelines for management of medical conditions. We're developing protocols that will allow us to send reminders to the patient that they are due for some tests.
We hope to reduce unnecessary care once we can have access to the information we need. So communication is key.
We can increase care level in many ways. One way would be trying to avoiding the unnecessary visits to emergency room. We can bring the patient more often to the office for preventive visits and avoid them to go to emergency room.
My patient has not been admitted to the hospital for 1 whole year, even the ER. Because the care provided at home, I'm able to check on her every 5 weeks just for health maintenance. And also in the meantime, I can anticipate for any abnormalities so that I can do my intervention in advance. So this will keep her healthy and safe at home.
This is really a big moment. I mean, it's something that we were waiting for. It's been long overdue. We as a physician, we should be working together. We should be cooperating more, and that will translate in better care for our patients and our communities.
Mi salud, mi comunidad.
My community, my health.
我社區我嘅健康。
My community, my health.
Mi salud, mi comunidad.
My community, my health.
My community, my health.